Hi, I'm Dr. Elizabeth Coyne, and Martha and I have devised this small mini lecture looking at qualitative research. So qualitative research, it's a philosophy rather than a distinct method. It's a method, when you look at qualitative research, it's a way of thinking. So it allows you that there's no one way to do research. It's not like science where you're measuring something, you can't objectify it. It's the experience of something. So human experiences that can't be objectified. And subjectivity is very important to sort of understand where your stance is, and you as a researcher and you as the person that's doing the interviews and the people that you're interviewing. It obtains rich understandings and enables you to sort of understand the context of why people do things and what motivates them to change. So it's inductive, so it really moves from a sort of a specific understanding, and when you do several interviews it allows you to understand then a general pattern of combined incidences. And so it's not that you have one interview and then you sort of say, well, this is going to be what we need to do, but you have a lot of interviews and you get this understanding, and that's where you can move from those incidences, that understanding, to maybe a general trend. It does not separate the researcher from the research context. It's not like when you do a survey, the researcher has no influence. When you're interviewing someone, you always will have influence because it's the way you ask questions, the way you ask the person to clarify. It also is the way that you may sort of, have that connection with the person that you're interviewing. Where in a survey, the person completing the survey has no influence from you as a researcher. It's emic approach, so it's sort of looking at that big picture stuff, understanding the cultural differences. Participants or informants are sort of identified rather than being subjects or clients. And the participants are the knowers of the experience. They are the people that we're asking, how do you experience this particular concept? So the researcher, in the process of doing qualitative research, needs to really look at their own biases. So if you were interviewing participants in relation to drug addiction, you'd have to identify, how do you feel about drug addiction? If it was about, gay and lesbian, you'd have to identify your biases in relation to that, and actually sort of keep them back so that you allowed your participants, the people that you're talking with, to actually talk about what their experience is. And so it's not experimental, with no interventions, very sort of naturalistic in approach. The researcher is looking for quality, not quantity of the phenomena. So you're looking to understand the experience of it rather than measure particular points in it. And the experiences are open to interpretation, hence the interpretive approach. So an overview of qualitative research traditions is looking at this sort of anthropography, which is this cultural ethnography, looking at culture, mapping the way that culture has changed the way we view the world, shared meanings and values, looking at psychology, the philosophy of the lived experience. This is where phenomenology takes in, where you're looking at the interpretations and the meanings of someone's individual experience. So this could be the experience of, having major cardiac surgery, having cancer, having a fall in hospital. How does that feel, as opposed to just measuring maybe the outcomes of falls? Looking at the sociology, the social settings. And this is where we might sort of actually look at grounded theory or critical social theory and social structural processes to understand sort of the way people actually share that experience together. When we're looking in social settings, we might look at, how the interaction of different people, maybe the interaction of social, sort of interaction of street kids. We may be looking at social interaction of people attending addiction classes and how that affects them. And we sort of that's would sort of be looking at that, developing a theory to understand these concepts. Social linguistics is looking at sort of communication, and so you might look in the discourse, how people talk about cancer, the discourse around, you know, gay and lesbian society, and how people talk about that, and the rules of conversation, and you know, the sort of the way we use different words. Often when you're interviewing patients with cancer, if they're particularly accepting of it, they'll talk about the word. But if they're not accepting, they'll often not use the word cancer. They'll say, I've been sick for a while. They might talk about that I've been in and out of hospital with this problem, but they may not actually ever mention the word that I have cancer. And so this is that sort of discourse analysis. We can also look at qualitative research with a historical review. We can look at past behaviour, events and conditions, and you can do a historical analysis of pictures. You might also do a historical analysis of, you know, sort of different documentation, maybe of events or past historical events. And so this then gives you a way to sort of understand what happened in the past to then to maybe hopefully improve it for future. So the characteristics of qualitative research is that we're exploring a phenomena. And a phenomena is just a concept, an idea, but it's what we're looking at is it's not quantifiable. We're not trying to measure or count it. And we need to be really flexible in understanding this experience. There's a lot of involvement with the researcher. Every time you do an interview, you know, you're asking this person to share a particular experience and to really tell you even sort of how they're feeling. Often as a researcher, when you're doing interviews, you are told bits of that experience that maybe this person may not have shared with their nurse or their doctor. The researcher, you are the instrument. It is your ability to go through a research interview and really get the best out of a person. Anyone can ask questions, but only a good researcher can really get a person to share their experience. And it's really this ongoing analysis. So if you do one interview, you then improve and understand, and you may add sort of and clarify. Often there's a process of several interviews to get the information, because you may come back to that person and say, can you just clarify on this where you talked about that you didn't understand the information correctly? What did you mean by that? How did you actually then get around that? And it's very holistic, so it's really wanting to understand the full information, the full concept of this phenomena. When we're looking at sort of the truth and rigour, a researcher has to identify that they really did get this information from this group of participants. And so to identify that it's credible, participants often or would need to be shared their transcript or the summary of these interviews with the person that was actually interviewed. So can participants recognise their findings as their own? This is part of this credibility, and this is called member checking, where the participants are sent back their information and they then say yes. It's often done at the end of an interview as well, where you might summarise and say, just to summarise, you talked about this and this and this, and this is your overall sort of experience. And then the person that you're interviewing would then say, yes, that is what I was meaning. Trustworthiness is often the logical process and transparency of the research. So with this looks at the way the research questions are presented. Are they open-ended or closed-ended? You know, how have they researcher connected? How has this process of the interview taken place? And also about the sort of the process of the analysis. Is the analysis coming straight from the interview? Is using that inductive process? Is there ability for anyone to then go through that process and actually look at these interviews with transcripts and come up with similar findings? The transferability and the fittingness is, you know, when you're looking at does this findings fit with others? This is often, you may say, you know, this would be transferable, generalisable to other contexts that are similar, but these were done in particular rural setting and so would not be transferable to a metropolitan setting. And these are all looking at sort of, is this truthful and is it strong research? This is what you need to do when you're critiquing research. look at this, and you should be able to see these parts throughout a research article. Triangulation looks at sort of what theories did they use to guide the research. Did they use different methods? So was there interviews and observations? Did they use different sources? So there was across age groups or male and female. This all helps you make sure that these interviews really give a true understanding. Were they, if they were just about nurses, was there male, female, different age groups, and maybe different health settings to enable that, yes, this then is able to be more generalised because I can see that the data sources were different. Different investigators also, if there were different people doing the interviews or the same person. This needs to be identified in the journal article to identify that, yes, these were the same interview questions used for all participants, but several different interviewers were used, or maybe the same interviewer and same questions, but several different researchers completed the analysis. So just to go over a few of the actual different types. So phenomenology really looks at exploring people's life experiences as they describe them. And so it's very descriptive. There are two specific types: descriptive phenomenology, which describes the experiences, and hermeneutic phenomenology, which tries to understand people's interpretation of these experiences. And so this might be, you might use this if you were exploring maybe volunteers' experience of volunteering with people with dementia, because they may have a personal experience of someone with dementia from their own experience, which is why they have become volunteers. And so we're wanting to then question them, and what is your interpretation of helping people with dementia? How do you interpret this? What is the sort of the experience for you, but how do you see this as, do you see it as a benefit, or do you see it as a positive? So that in their interpretation of those experiences, as opposed to just saying that, yes, it's complex that I work with people with dementia. Grounded theory is another particular type of qualitative research which really seeks to describe and understand key social and structural processes that occur in a particular setting. And so it aims to generate understanding or theory to describe these knowledges, but it really focuses on social interaction. So you might be wanting to look at sort of the interaction of nurses at end of life. So we know that this is a particular time when nurses often struggle. And so if we did interviews in relation to this, we might ask and sort of try and describe their meaning of this interaction at end of life, and how they actually work with that. How do they, what social aspects do they use? What structural processes? Do they use a debrief? Do they, sort of assign a reflective process to after they've worked with patients at end of life? And then this would then help us generate some sort of theory that nurses at end of life do better if they're using a reflective framework to debrief after each shift. And it really focuses on that social interaction. So how do nurses interact during end of life care? Historical research, where he looks at sort of the phenomena is isolated in history, and so we're looking at maybe medical records, maybe looking at the way a particular aspect was documented, videotapes or photographs or reports or letters. So you might look at sort of different photographs that patients or have taken over time, or different photographs of if you're looking at historical research in relation to wars, you could look at analyse the way nurses were portrayed in the war. That sort of what these photographs mean. So this would be then a sort of a historical research of war photographs depicting nurses providing care. We could look at sort of hospital admissions or medical errors also in this way, where we're ascribing a sort of a understanding of the experience, not just sort of getting numbers to it, but looking at, in relation to these medical errors, what was documented, what was the meaning, was the patient interviewed, what other aspects happened in relation to these medical errors. And that is the end of my slides. Thank you.